Hello, ladies and gentlemen. Good evening. This is session 7, Pneumomediastinum. Let's enjoy chest radiographs with Dr. Y. This is a review of session 6, Silhouette Sign. This film is, as we see, left lateral film. The lesion is at right lower lobe. What will be the PA film findings? Let's imagine. This is a frontal film and the answer of the previous film, the lateral film. Does it match what you guessed? Let's see first. How about the heart border on the right side? Right atrial border. Yes, it is well preserved. And nothing happened to minor fissure. That means minor fissure is okay. Right middle of lateral segment is okay. This is a review of session 6, second one. Where is the pneumonia? Maybe this one? It is in left lower portion, not upper portion, so easily guessed as lower lobe lesion. What about the silhouette sign? Left heart border, left ventricular border is preserved. That means because heart is in anterior location, the pneumonia is posterior location. And diaphragmatic border is also obscured. And let's imagine the lateral film findings. Does this finding match with your imagination? Please tell the findings to yourself. Okay, I'll say briefly. The triangular consolidation in the posterior portion with visualized major fissure. Nothing happened to anterior and upper portion, and only one diaphragm line is visualized. Yes, this is left lower lobe lesion of posterior and inferior lesions. Now let's begin our new session. Session 7, Pneumomediastinum. Fleischner Society is telling us that the pneumomediastinum is the presence of gas in mediastinal tissue outside the esophagus and tracheobronchial tree, particularly associated with bronchial asthma, severe coughing, or assisted ventilation. How to say simply air in the mediastinum. You see this axial long window setting CT scan of showing the many gases in the mediastinal structure between esophagus and pulmonary artery and between aorta, and both lung shows diffuse ground glass opacity of ARDS. Let's see this film, frontal film. At midnight, this young lady with status asthmaticus visited the emergency room. What do we see? Lung field seems to be normal. Heart seems to be normal, not enlarged. What about this area? Look closely. Look closely. And this is lateral film. What do we see here? What do we see here? And what do we see here? Okay, let's see closely, precisely, and slowly. What about this enlarged film? This area seems to be in black color, and most of all, what do we see is black color outside the left tracheal wall, outside the right tracheal wall. We see the outside wall of left main bronchus. That is not usual. We see the outer wall of right main bronchus. That means there are gases outside the large airways. This is the lateral film. We see the outer wall of frontal trachea and outer wall of posterior trachea and anterior portion of ascending aorta is visualized with black contrast. These are all air in the mediastinal structure. What do we see with this film? Tracheal tube, central line to the distal superior vena cava, and both lungs are white with air bronchogram. Means ARDS. And we see the black contrast, air contrast here, here, from the neck, right and left. We see aorta outside, we see the outside of heart, ventricle, and inferior portion also shows the black contrast, right atrial border, and right side mediastinal border all shows black line. And we also see the outer wall of the left main bronchus, meaning air contrast at outside. This is pneumomediastinum, extensive pneumomediastinum in ARDS patient. How about this supine AP film? Endotracheal tube, central line, another central line with gas at the upper shoulder or lower neck intramuscular planes on right and on left side. And this is subcutaneous emphysema. Also, lower neck gases and extensive, what we have seen before, the extensive air all around the mediastinum and heart. Yes, pneumomediastinum in the ARDS patient, another patient. Now, when we see this coronal long window setting CT image, we understand what happened to the chest film of this patient. Many gases at around the neck, in the mediastinum, around the trachea, around the large airway, around aorta, around heart, even below the heart. This red arrow shows continuous diaphragm sign. This means pneumomediastinum. Absolutely. Continuous diaphragm sign, that is. And both lungs are ARDS. Diffuse bilateral white. This is a small boy with a frontal radiograph. Now I understand you can understand or even enjoy where the gases are. Is that match with this coronal CT images? Yes, everywhere gases. One thing we have to learn is mediastinum is not a closed structure. It is an open space to the head, to the abdomen, not a closed safe area. Have you ever seen this kind of wonderful image before? This is a small, very small baby, even premature baby with RDS, respiratory distress syndrome. What does it look like? What does it look like? This is air below, between thymus and heart. So it is look like spinnaker sail sign, or sometimes we call this as angel wing sign. The air in the mediastinum pushes the thymus upward, so it's look like an angel wing. This is a typical pneumomediastinum of a premature baby of RDS. Where do we see the air? Gas collection. Where is it? This old woman got an operation at the heart. Yes, gas here, round ovoid. This coronal CT image shows clearly where the gas is. Yes, it is in the pericardium. So this is pneumopericardium after cardiac surgery. Hey guys, what is your answer for quiz 6? Teardrop and agios pain? Congratulations! This is just looking like teardrop. And this is coronal CT. And this teardrop of agios pain comes from here. Push down the pleura, 2 layers pleura here till here. So these pleura is composed of 4 layers: visceral, parietal, visceral pleura, and inner side is we call agios lobe. This is actually the apical segment of right upper lobe. Congratulations again. This is the quiz for the next session. Frontal radiograph of a young woman. Please look closely the ribs and the right heart border. Thank you very much. Like, subscribe will be a big support to me. Thank you very much.